When we talk about the quality of weight loss, we are referring to which tissues are lost and in what proportions. We're not referring to the metabolic effects of treatment, such as the reduction in cholesterol levels and in chronic inflammation that may be achieved by one treatment or another, and which, though hugely important in the treatment of obesity, are not parameters of weight loss. For the purpose of evaluating weight loss, we partition the body into fat mass and fat-free mass. The fat-free mass is everything except the fat, and is made up of muscle, bone, water, skin, and the internal organs. During weight loss, we want to lose fat and keep the fat-free tissues, though clearly, as body volume decreases, we will have to get rid of some water. A loss of bone increases the risk of osteopenia later in life, and a loss of muscle has very significant metabolic and functional consequences. The internal organs do often decrease in size, but that's usually a sign of improved organ health and efficiency. There are 3 types of muscle in the body. The type that interests us here is called skeletal muscle, which is the muscle you can feel under your skin. Its most obvious function is movement, but it does so much more than that. It is a major contributor to our basal metabolic rate, which is the energy our body uses just to keep us alive before counting any calories used for exercise. Muscle helps maintain body temperature through involuntary contractions that generate heat. Muscle is essential for breathing as it lifts and expands the rib cage. It protects our joints by helping to keep them aligned and stable, and muscles act as dynamic shock absorbers. The internal organs of the trunk are held in place and protected against injury by our abdominal and pelvic muscles and the diaphragm. Posture, stability, and balance are under subconscious control as muscles constantly adjust their tension to maintain our posture. The face has more than 40 muscles that hold our facial skin in position and generate facial expression. And muscle plays a major role in our metabolic health as it secretes and responds to numerous hormones and other signaling molecules, helping to control the internal metabolic environment and energy balance. It's especially important in the control of blood sugar levels because it takes up around 80% of the sugar absorbed from the gut after a meal. And it acts as a protein store. The body does not have a store of spare protein in the way we have fat as a store of energy. When the body doesn't receive sufficient protein in the diet, protein is drawn from muscle to satisfy other functions. Given all these beneficial functions of muscle, when we treat obesity, we want to make sure we lose as little muscle as possible. Muscle loss is associated with increased risk of weight regain and of metabolic disorders such as diabetes. Muscle loss is also the underlying cause of frailty in the elderly, with loss of functional independence and increased instability leading to falls and fractures and premature mortality. The protection of muscle tissue during weight loss depends to a great extent on the provision of all the nutrients required for muscle health and maintenance, as well as the correct stimulus to the body. The main nutrient for muscle structure is protein. However, energy is required to incorporate that protein into muscle, and vitamins and minerals are needed for these chemical reactions and for the correct function of muscle tissue. Recently, since the introduction of the GLP-1 receptor agonists for weight loss, such as Wegovy and Mounjaro, there has been a lot of talk about how much muscle is lost during weight loss. The Step 1 trial of semaglutide, which is sold under the name Wegovy, showed an average weight loss of around 15% of total body weight, but less than 2/3 of that was fat mass and over 1/3 was lean tissue, mainly muscle. Although the cause of this muscle loss still needs to be fully explained, diet and lifestyle during treatment with these medicines is probably a major factor and should be carefully supervised to minimize the risk. On this subject, low carbohydrate diets have been shown to favor the preservation of muscle mass during weight loss, and well-designed, very low-calorie ketogenic diets, which have a stricter carbohydrate restriction, have also been shown to favour muscle preservation despite the rapid rate of weight loss. In summary, muscle has many functions in the body apart from enabling us to move. The preservation of muscle mass during weight loss is associated with better long-term metabolic health and a lower risk of weight regain. Preventing muscle loss during weight loss is a feature of well-designed weight management programs and depends on diet and lifestyle measures that stimulate muscle growth and inhibit the use of muscle protein for other body functions by providing an adequate dietary intake. Thank you for watching this video. I hope you found it helpful.